I like my job, and I've been a mental health nurse for it's more than 40 years, so I'm not going to give my age away. September last year, I was walking my dog and she happened to pick a fight with another dog. During that fight, I intervened and I was bitten by either of the dogs, I don't know which. As a consequence of that, I contracted sepsis with quite a virulent bacteria. Essentially went into shock, lots of organ failure, and the result of all that is what they call a quad amputation. All of my life I've been very independent. I never felt as if I'd lose it. I always just thought, and I still do, it's something you're constantly working towards. My wife's the gardener, not me. I used to do the heavy jobs. Yeah, the carer thing is quite important. I think the big thing for Anne has always been, if I know the help's there and how to access it, then that makes me feel better already. When I was considered to be medically fit before I was actually discharged, this rather nice man called Nadeem turned up, and he explained that he was the hospital social worker. He explained the concepts of social care. As soon as we started the assessment, it was obvious that we were also going in a direction.
What makes me proud about working within the hospital setting is having the opportunity to work with hospital OTs, physiotherapists, doctors, working with the individual to meet that individual's need collectively. Crucially, the individual is the heart of the work that we do.
The right services were put in place in a very caring way. Nadeem was the hub. Essentially, it did feel like a joined up approach.
I think Julian naturally is a confident man, and I think it was about trying to ensure that we harness that positivity that Julian has. The strategy offers us opportunity to work with individuals around their needs and promote their confidence and independence, and allows them structure and control to think about the services that they want and how they want to live independently within the community.
All the services that I need have been provided and I feel well cared for. The difference that adult social care has made is the difference between being in an institution and being miserable and being at home and being happy.
My life was a bit of a struggle. I've always wanted to do things like be out and about, meeting new people. Basically, my head was all over the place.
I started working with Shane in May 2017. His social worker in the transitions team referred him to the Knots Enabling Service. I know that Knots Enabling Service have changed Shane's pathway for the better. His social worker told me that he was planning to commission 2 days of day services for Shane. And now what we have is someone who's happy with their life, working hard, getting paid, and for those other 5 days a week not being bored, sat at home.
Ever since me and Aidan have been talking, ever since I've called him my brother, he's shown me some good skills, he's a nice lad. I can't have no one better than him, because he's quality.
I quickly found out that Shane was very good with people and his social skills were great. He always makes me laugh. He wanted to do some gardening and also he wanted to help people, which is why he did some volunteering at the community gardens. I increase a person's confidence by focusing on what strengths they do have, because I believe if you focus on things that interest someone, you're likely to get the best out of them.
I have the confidence to actually do something now in my life.
I'm proud that I've enabled someone to be able to do those things that they wouldn't necessarily be able to do before or believe that they could do. And I think that sums up what the Knots Enabling Service is about. We've changed someone's life for the better and actually made him more independent.
My passion is basically birds of prey. The best of all are my peregrines. everything you've got is all based on a bond. If you haven't got that bond, you haven't got anything worth having. When I got told that I'd got dementia, I was told that it would gradually get worse, so it meant I had to get rid of my car. I got rid of quite a few of my Falcons, what have you. Hardly anybody ever rings me up about Falcons at all, see. You can't expect it to go on forever, but anyway, it's finished with now. Mary and myself do everything that we can. We help one another. So we've said at times we'll have to have some help.
As an occupational therapist, I try to promote a person's independence. I always start off with a person-centred approach because we just want the best for the person. So I think that's quite a good thing as a therapist to work in a team that do actually promote that. When George initially came home from hospital, he did state that outdoor mobility was one of his goals.
I'd been in the house for a long time and I was quite pleased to be able to get out and have a walk. I says, I haven't been out for weeks.
From the very young age, when I was a child, I used to idealize my father. He was very fit and athletic, and he was a police officer, so he used to do exercise every day. I used to think, oh, one day I'm going to be like him. So keeping myself healthy and fit, that meant a lot for me. I contacted Nottinghamshire County Council Adult Access Service because it was recommended by my friend.
People normally get in contact by phoning the customer service centre. Information's gathered, then it's passed through to the Adult Access Service, who will then call back, have a conversation and establish the best way to assess somebody. Seema was invited to our clinic. She was very nervous, didn't know anything about equipment, and unfortunately she'd lost confidence trying to access her bathing facility. She stopped taking care of herself because she was scared.
Jane made me feel so valued because she was listening to me, and she was very good in picking where I was struggling, and she just focused on that.
I love my job. Helping people do their everyday living tasks, getting into your bathing facility. We take it for granted every day that, you know, it's easy to do, and seeing someone with a big smile on their face once they've tried a simple piece of equipment that is going to give them that independence to get back is such a big achievement for both that person and for myself.
Without Jane, I would not have known that I can help myself. It changed my whole view of care and how I can make myself independent.
Originally, she was maybe thinking of carers, but with the simple provision of the shower board, it has promoted her independence, made the person happy and their life bearable again.
All my life, I've liked to be with people. I used to work for British Home Stores. I used to be head cashier and, you know, in charge of office there. I think that still rubbed off on me here because I have to talk to everybody and interfere. My husband died when we were both 52, he had a heart attack. So I'd always looked after myself. And then I got to a time when all of a sudden it wasn't easy.
We received a referral for Jean. She was at Berry Hill Care Home. She was self-funding her care, and then she went below the threshold. We said, Jean, we're going to give you a choice and control over your well-being and welfare. We want to see what you can do and how we can support you. We need to be creative. We need to think out of the box to say, what will make this person live longer, be more independent.
Once you start encouraging and promoting that independence, you see them starting to do more things for themselves. They've been amazed that there's this sort of facility to come to, because they never wanted really to go into care deep down. They just didn't think there was any other choice. But they've really blossomed, haven't they, and become independent and wanted to be back in the community with the correct support.
Chelsea and Victoria, from the beginning, have really understood me. She talks to me like a person, makes me feel better, because that gives me confidence that I think, oh, you've still got a mind of your own.
The ethos of the short-term independent service fits in really well with being an OT and what our role is all about. We obviously want to help people live the life that they want to live and just to improve their health and well-being.
I really love my job because it has proven that people, they can be re-enabled, they can take control, they can be fully independent. This short-term independent service, that's the way forward.